My name's TJ. We're going to do the adult health one. Sorry, Professor Sink. We're going to do an IV administration, but through Piggyback. So what we're going to start off with is the check protocol, check the MAR. The doctor has ordered to administer 1 gram of Rocephin. What's available is 500 milligrams per ml. So that means we're going to give a total of 2 ml into the secondary bag. Calculating the drip rate and all that, it will be about 17 drops per minute. And we'll take care of that in a second. Rocephin is indicated because the patient has pneumonia. It helps treat respiratory tract infections. I would check the MAR for pertinent labs. I would check the MAR also for the patient if they have any allergies to penicillin or dairy products. And then the medication will be given over a time of 30 minutes. I'm going to assemble my meds. First, I'm going to, I wash my hands. I'm going to clean off the top of the vial. The sharps would, or I'm going to use that for my, okay, so now I'm going to set this aside, get my mini bag, I'm going to clean off the port, administer the medication into the bag, now we'll go in the container. I'm going to mix up my mini bag. I'm going to label it, put what drug it is, the amount, my initials, date, time, and the patient's name on the back. So now I'm going to assemble my drip bag. Prime the tubing. Prime it. Clamp here, run, clamp it off, it's ready. And I'm going to take all this into the room. I see that the patient already has a patent IV. I'm going to identify my patient, look at their wristband, and check their name and date of birth. Look at the IV site, there's no swelling, no pain. Ask patient if they're in pain. No edema, anything like that. So I'm going to explain to them that the doctor ordered Rocephin and that I'll be hanging it with this carrier fluid. So I come in, hang this primary bag lower, piggyback, starting time, hang it up. I'm going to take my alcohol swabs. Before all that, I've washed my hands, still on gloves on. Come back to this. Now I'm going to alcohol the closest port to the carrier fluid bag. I'm going to clamp this off to the patient. Pick up the mini bag. Going to establish my drip rate of 17 drops per minute. That's about right. Then I'm going to I'll unclamp this main line and get my 17 drops per minute. All right. Once that's finished, I'm going to make sure there's no adverse reactions. Make sure the patient is tolerating the medication. Then I would exit the room. I would document everything that I did. I would document the time I added the drug, what drug it was, the dose, the route that it was going into the patient, the condition of the site, how the patient tolerated it, and the volume of fluid. And that is it.